100% of our patients on day one, they have a treatment. Day one, they have a treatment plan.
Wow.
85% of them pay on day one for the IVF.
Wow.
So you can imagine, and they pay, so we don't have to go around and, wait 120 days for the insurances and fight with them and put, 6 hours of our employees fighting with insurance. We don't.
And that's so important, right? If your eggs are getting old, it's so important not to wait.
There is some average in the industry about from the first visit to actually get the ending of the first treatment, and is anywhere between 4 to 6 months.
Wow.
Ours is 48 days.
Wow. It's incredible.
So those are the efficiencies that we're doing that are different in the traditional fertility clinics.
We all know that IVF is very stressful, but for many people, it's also very expensive. So on today's episode, I'm going to introduce you to Dr. Francisco Arredondo. He's going to tell us how he was able to democratize IVF. He is able to charge less and still maintain success rates that are fantastic. So I can't wait for you to hear this episode and understand that you do have choices, and there are many ways to build a family of your dreams. From our Building Your Family community, this is the Building Your Family podcast. I'm your host, Lisa Schumann, author, researcher, and reproductive medicine therapist. As the leading destination for support and education for people using reproductive medicine to grow their families, we cut through the noise to provide you with research-based information, effective and actionable strategies, and the support that you need to feel better so you can get into the driver's seat of your life and build the family of your dreams. We look forward to seeing you inside. Welcome to another episode of the Building Your Family podcast. Today, I have a very interesting guest for you. His name is Dr. Francisco Arredondo. I want to tell you a little bit about Dr. Arredondo because it's so interesting to think about how he's gotten to the place where he's in right now. So just a quick backstory. He graduated summa cum laude from Monterey Institute of Technology, and he was also awarded from the Mexican president, one of the best medical students in the country. He went to work at the World Health Organization's Reproductive Biology Center before coming to New York, where I met him, where we were both associated with the same fertility clinic. And fertility fellowship he had at the University of Pennsylvania and a master's of public health at Harvard. And then he focused on international health and business management. Then on his 40th birthday, he was inspired to combine his medical and entrepreneurial and management skills to follow a new path. He went to San Antonio and he oversaw 50 fertility specialists or more. And then he could have decided, I'm going to go sit on a beach and have an umbrella drink, but instead he has decided to find a way to democratize fertility services. He believes that we can all have access to care because he can simultaneously increase safety, affordability, and quality. His new program is called Positive Fertility. You've probably seen him on the internet because he's there all the time. And today he's going to tell us all about it and how he's managed to do this. So welcome. So good to see you.
Thank you very much. Appreciate it. Happy to see you and happy to have a nice conversation this afternoon.
So could we start by talking about this plan you decided after doing so many amazing things in the world of fertility, and after all of your education, you decided rather than continuing just to build fertility clinics, you really wanted to do something to help patients have more affordable care, but also have quality care, which is very, very difficult to do. So maybe you can tell us how you were able to manage that.
Yeah, well, everything has started because while I was writing the book, the Medicalpreneur book, and I did some research, it was, for people that have been in the industry for a while, and I don't know if anybody has seen the movie Joy, which I recommend from Netflix. the first IVF, successful IVF, was the 120th attempt. You can do the math and what percentage is that.
Incredible.
When we started this in 1978 and then, until the early 90s, pregnancy rate was very low. Was 10,
Yes.
15, perhaps 20% in simple cases. And we have come a long, long way in 47 years. So to the point that for those people that don't know it, the average pregnancy rate naturally per month is around 20-25% max in a given month. We are talking now in our industry that every time that we transfer an embryo with adequate chromosomes, we are in the 60%. So we are three times nature.
It's incredible.
But yet, only 5% of the population can afford it. So what's the good on having all these great technology and making all these advances in health when the people that most need it and the people more vulnerable can't afford it? As a member of the community, of the scientist community, of the healthcare community, I just thought that, while we've been crushing it in pregnancy rates, we've been awful at making access possible. So I said, gee, is there a way that we can remove everything that is waste in the process of IVF? What is the most essential things? And here leads to different things, because our brain is very trained to, when you want to improve things, you want to add things and add things and add things and add things. And that's why all the testing that sometimes is unnecessary, we call it add-ons.
Yes.
In fertility, because it's an add-on to the basic fertility. And when you compare the marginal increase in success versus the marginal increase in cost, it doesn't provide value. And sometimes it's actually detrimental, but it's more cost. So we went and started analyzing the process and seeing what was essential and what was not essential, and probably actually sometimes causes more harm. So we also start looking at the whole system and start thinking how we can make it more efficient and trying to utilize every single individual at the top of their license. So that's how we began. It began by, hey, is there a way? And we started looking at other industries. And one of them was the manufacturing industry. And not that the humans or fertility patients are cars, but we learned a lot from the Toyota production system, where they don't compromise. And that's exactly where we're inspired. Because I don't know if you've seen that there's, when people ask, hey, how can you improve a process? You either decrease the price, you increase the quality, or you may improve the customer experience. In Toyota, you don't compromise on any of those. You actually pursue the three at the best level. And that's what we're trying to do. Trying to remove the cost, sometimes to improve the quality with less cost, and also giving a very, very good customer experience. For people that know what we stand for when we created RMA of Texas, we stand for customer experience. We were leaders in how to create our best customer experience for the patient. Nowadays, we're focusing on how we can make it more affordable. And the reason is because there's only three things you can compete: quality, customer experience, or price. When we did RMA of Texas, we came to a market where we had 0% of the market, and the patients, the people there had very good pregnancy rate, great quality, and the pricing at that time, we didn't want to fight in the price, so we focus on customer experience. And nowadays, we're focusing on decreasing the cost, improving the customer experience, as well as improving the quality. So it's a three-leg stool that we are trying to achieve. Because if you think about it, the companies that are leader in two of those aspects, they are never beaten. Let me give you an example.
Yeah.
Starbucks, are they good in price? Oh no, we pay $6 for a coffee. They're not
Yes.
competing in price. How about quality, consistency? Everywhere you go is exactly the same taste, very
Right.
consistent. And customer experience, wow, they even ask you your name and this and how are you,
Hmm.
Paco, hello. So they're very good, and it's very hard to catch on them. Southwest Airlines, do they compete on quality? Not really. They don't even have first class. They just give you peanuts. But what about customer experience? They're very good and the prices are very low. And that's why it's the only airline company that has been profitable since day one. So the aim is to, when we create positive, is how we can make it more affordable. Because what happens is, no matter what industry you are in, there's three levels: high, medium, and low. Let's go to hotels. Ritz-Carlton, Four Seasons, you have Wyndham, Holiday Inn, and you have Motel 6 or budget motel. You go to the cars, you have your Ferrari, your BMW, you have your Toyota or your Corolla or your Hyundai. And you go to stores, you have your Bloomingdale's, your Saks Fifth Avenue, you have your Macy's or Dillard's, and then you have your Walmart and Target. So currently in the United States, the 5% of people that can afford IVF are going to the Ritz-Carlton or Four Seasons. And when I say it's Four Seasons, Ritz-Carlton, I'm talking about price, not the customer experience, just talking about the price.
Hmm.
So we decided to provide the same quality at a much more affordable cost. And we streamline the process. We remove a lot of the fat. And we were so lucky that in the first year that we opened, we were profitable. So we were profitable in 1 year. We caught the attention of several people. More than 6 different people came and knocked at the door. And finally, we got the correct partner and we raised $20 million. We opened Houston. I'm in Houston today. And Houston, the first month we sold 50 cycles like that. We are really, really rocking it. So we use also nurse practitioners to do the first part of the process and the scanning, etc. So that's how we have been able to be very transparent. And actually, we are the only center in Texas that 100% of their treatments is online, is transparent, totally transparent. So transparency works for us, and we've been very lucky. So that's some of the things that we did.
So, if you could tell me, Dr. Ando, what, for the people out there who don't really understand how this process work, or maybe they're starting their fertility journey and they're thinking, well, I go to these fertility clinics and all of them have like this range of how much things cost. How is it possible that you can provide those same services, a good lab, doctors who are well known or at least well educated, people who can understand the process, people in the nurses and the staff who can handle all the patients' information? How can you give patients all of this but not charge them as much?
Because we minimize waste. Let me give you a couple of examples.
Yes, please.
So, number one, we don't use insurances. And insurances are, we have in our website a line that I think is perfect. Do you like working with insurances?
No,
Neither do we.
no,
So
no.
basically, what we do is, if you go to any place in Texas, 95% of the patients have some coverage of the diagnostic part,
Hmm.
and very few, 20%, perhaps 25, will have of the treatment part. So this is what happens. Let's grab 100 patients. They go to the traditional fertility clinic.
Right,
Hey, I want to go there. Oh, no, my insurance covers, so I want to go and sit down and talk to the doctor.
right.
Okay. So they sit down. They spent 1 hour talking to the doctor, and the physician has close to zero information about them. They don't know anything. So now you spend 1 hour talking to that. So those 100, then you say, you explain them, you need three things to get pregnant. You need a sperm, you need an egg, you need a place for them to have a date. So guess what? I'm going to order you an AMH to check your egg reserve. I'm going to order a semen analysis to check your sperm count. And we're going to order an HSG, or we're going to order a HIFO-C. In certain places, everybody needs to have a hysteroscopy. I wonder why. But you don't need a hysteroscopy.
No,
all the people don't need a hysteroscopy, but in certain places, you walk in, you're a hysteroscopy. So then you do that and you order the test. 20% of those guys will never do a sperm test. Fear, ego, you name it.
Really? Wow.
A lot of people, they can convince them. Then to do the test, to check your tubes, they have to do it in a certain part of the period. So they schedule it, this month, the next one, I have a wedding. Make the long story short, I don't know, is it covered by insurance? It's not covered by my insurance. I have to go and look at the certain places where do it, not my OBGYN, saline ultrasound, blah, blah, blah. Make the long story short, from those 100, 3 to 6 months later, half of them come back with the test. The other ones, they didn't. No, I don't. And then, because most of the traditional fertility clinics are not transparent in their pricing, I challenge every patient or people to call to any fertility center and says, tell me how much is an IVF. Well, it depends on this and that. Well, it depends. They come with the test, and then at the end of the day, they say, you need IVF. Okay, how much is IVF? Well, $25,000. From those 50, only 10 can pay it, or 20. So this process is all waste. That was waste for the patients. That was waste for the physicians. And what we've done is to re-engineer the process. We don't see anybody that doesn't have an AMH. We don't see anybody that doesn't have a semen analysis. We don't see anybody that doesn't have an HSG, or on the first day, we can do a HIFO-C, which is much better than HSG nowadays. Painless and no radiation, etc.
Oh, really?
Yep. So 100% of our patients on day one, they have a treatment. Day one, they have a treatment.
Wow.
Plan. 85% of them pay on day one for the IVF.
Wow.
So you can imagine, and they pay, so we don't have to go around and, wait 120 days for the insurances and fight with them and put, 6 hours of our employees fighting with insurance. We don't.
And that's so important, right? If your eggs are getting old, it's so important not to wait.
So there is some average in the industry about from the first visit to actually get the ending of the first treatment, and is anywhere between 4 to 6 months. Ours is 48 days.
Wow. It's incredible.
So those are the efficiencies that we're doing that are different in the traditional fertility clinics. The other thing is that we use one stimulation protocol, because there is no evidence that changing the protocol, there's no solid evidence that changing the protocol, you're going to increase your pregnancy rate. Not really. The two most important ingredients, which are egg and sperm, are different every month. The thing is, it's very humbling for all the fertility specialists that we are out there, that after 4 years of college, 4 years of medical school, 4 years of OBGYN, and 3 of infertility, that a lot of the things that we're doing do not add value. They actually do not add value. It's very humbling because you go through so much, but the truth is that if we want to practice value-based care, value is outcome over cost. So you can improve the value by either improving the outcome or decreasing the cost. So that's how we make all the decisions. So it's very simple at the positive to make decisions, because we have a very clear formula.
Imagine your beautiful future. You're snuggling with your child. You feel so connected to them. Your friends and family are so happy, and you have everything that you've ever wanted. I want this for you too, but I want more than that. I want you to feel secure knowing that you've made the best decisions, not just short term, but long term for your future family. Wherever you are on your journey, whether you're choosing a donor, choosing a clinic, learning how to talk to your donor-conceived child about their origins, all of these decisions will have wider implications for your future. And I want you to have the right resources so you can feel empowered and confident at this very important time in your life. That's why I'm so excited to introduce you to Building Your Family. It's the only expert-guided platform designed for parents and parents-to-be using reproductive medicine. We provide unique strategies that you won't find anywhere else to make your path to parenthood smoother and more informed. And that's why our approach is about offering practical and actionable steps that you can use right now. Whether you're just starting out or already deep into your process, Building Your Family is here to guide you with expert advice, specialized education, stress reduction strategies, and a community to support you every step of the way. We can't wait to see you inside. So can you give us an example of some of the things that, because I'm imagining from what you're saying, if all of these people who are first going for a fertility consultation, there's only a small number of them who are actually going to do everything they need to get to IVF. So, and you're seeing people when they're ready, you're seeing that smaller number of people, right? And so they're probably the more motivated patients, which is great. They want to do treatment and get through it, and they're motivated to do it. So what will their experience be, and how will it be different if they went to, let's say, a traditional practice? What are the things you're saying? Cut fat. So what is some of the things that you feel are not necessary?
Number one, we have a standardized protocol, and we have created bundles of pricing. For example, in every single traditional fertility clinic, when you do the in vitro fertilization, and people that run businesses knows this. If you need $100 to run your business, $50 to $60 are labor. In fertility, when we go to a traditional place and you do the embryos, you check the embryos on day one, and every single embryologist has to check every single embryo, document, report, call the patient. Then they do it in day 3. They check, they document, they call. Then they do it in day 5 and in day 6. What for? Oh, because we have always done it that way. But what for? Because we are transferring all the embryos on day 5. And you're opening and closing the incubator. What for? You're just changing the environment. So we educate upfront our patients, which basically is very simple for us to educate them. Why? Because the people we're seeing was the people that the industry previously told them IVF is not for you. This is the people that we're seeing, the previous non-consumers. So they had no expectations. We're seeing everybody, but the big bulk is the people that the fertility centers before were saying not to them. They're pricing them out. So that's why we don't even consider ourselves competition for the traditional fertility clinics. We're in a different market. We're in a total different market. When we enter into this city and another city, and the established people start just panicking and responding and knocking at the doors, trying to what they're going to do. Don't panic. The market is so big, and we are focusing on market that nobody has been focusing. So that labor that the embryologists were documenting, it's a lot of hours. That's a lot of money. We take them out. It's no longer there. And we just educate the patients up front. This is how it's going to be. There's a phrase that I love to quote in customer experience, that is satisfaction equals performance minus expectation. So if we set the correct expectations, if you go to the doctor and tell you it's not going to hurt anything, and it hurts a little bit, you're done. You're cooked. You set the wrong expectations. You say it may hurt, it may be this, and it hurts the same amount, you're golden. And you perform exactly the same, but the expectations were set different. So if you set the correct expectations and you perform, you have a certain level. But if your expectations are very high, no matter how you perform, you're not going to make anybody happy. So that's something that we educate our patients, because our patients have previous no expectations. The industry, the traditional fertility centers have told them this is not for you. IVF is not for you. You can't afford it. And we have said, no, you can. And you know what? We still are pricing out a large amount of people. As good in pricing as we are, we still, I love to give this quote, because when somebody tells me, some of my colleagues tells me, oh, Paco, but it's only $2,000-3,000. I said, this is the kind of bubble that a lot of us live. Currently, in the United States, 50% of the people in the United States do not have $1,000 in the bank.
Wow.
So when you say, oh, it's only $2,000 more, what are you talking about? It's a total disconnection with the reality of the great group of people in the United States. So, we price them out. And what we're trying to do, we still, we're at $8,000 with everything included: anesthesia, general sedation, the transfer, the storage, everything, IVF,
Wow.
EC, everything included except medication.
Really?
Yeah. So even that's a lot of money. That's a lot of money for the great majority of Americans. So,
Yes.
so what we're trying to do is trying to find ways to decrease, and there's some room of opportunity. Medications is one of the big things that we certainly need some improvement. But those are some of the things that we've done.
So that includes ICSI for every cycle?
Yeah, every cycle.
And that includes
everything.
The anesthesia?
Everything. The sedation, the extraction, the embryo transfer, the monitoring, the blood test, the counseling, all the cheerleading and hugs that we give our patients are included there.
Mm-hmm,
so everything is there. And the idea is that when the patients pay, they don't have to worry about only and focusing on their care. Because what happens in the great majority of places is that they get a bill from the anesthesia, they get a bill from the surgery center, they get a bill from the lab, they get a bill from the pharmacy, they get a bill from the ERA testing, they get a bill from anywhere. So the patient, if they had a hysteroscopy, like a lot of people around here do, they got a bill from the insurance, then the co-payment, the deductible. Is just, and the other thing with the insurance is that people say, oh, we cover IVF, the insurance. Okay. Does it cover ICSI? Well, it may not. Does it cover meds? Well, may not. And it's $3,000, $4,000, $5,000, ICSI another $1,000. Does it cover the freezing of the embryos? Oh no, another $1,000. Does it cover PGTA? Oh no, for sure no. So instead of a cycle with PGTA that costs $25,000, $30,000, they say, oh, you know what? You're going to pay only $14,000. Well, big discount. Oh, by the way, but your deductible is $6,000 or $5,000 or $4,000. So, you pay $15,000 instead of the $30,000. So we say, what the heck? Just give it to us. We'll take care of the problem without any intermediaries, any people in between. So, the old-fashioned way of doing good business. Unfortunately, the healthcare industry it's a very, very challenging industry in our country.
Yes. You just mentioned PGT. Is that included in this cost?
We have 4 prices. So we have a PGTA. If we include the IVF with the PGTA, it's $11,300, something like that. It's on the website. I don't even know it, but it's in our website. It's like $11,400. That includes everything, PGTA, and we don't. So you go to any center, it says, oh, if it is 1 to 3, it's a certain amount. If it is 4 to 5, it's a certain amount. It's one price for us. That's it. Whether you have 1 or you have 200, we don't care, because you have to keep it simple. Otherwise, people are already very stressed out. Nobody wants to be here.
No, it's true. It's so true. I'd like to ask you 2 questions about variability. So in terms of a person's personality and who they are, but also about their issues. Let's look at the issues first. Let's say there are things that are different let's say I'm someone who, as many of you know in the audience, if you're a carrier for something, you may need a process called PGTM, right? Or let's say there's something special about your uterus. You may need a special surgery. There may be things about you that are different than, let's say, your typical IVF case. So in those situations, how do you handle that?
Great. Beautiful question. So, for example, the gestational care is when a person needs a gestational care. We don't do them. We refer them to the other traditional fertility clinics. That's what, certain things we are actually feeding them. PGTM, we have developed a wonderful approach. And this is, I have to give credit also to Dr. Millie Thakur from Genomali, because we work like Lego pieces. The Lego piece, which is doing the stimulation, getting the eggs and everything, is positive, and we just are very oil machine. When we have patients that need the carrier or the PGTM that you well mentioned, we send them to Dr. Thakur, and she takes care of everything because she has a very oil system she works online until she develops the probe, until she identifies all the people that carry that particular gene, maps out the whole genetic tree. And sometimes people that know this, it can take as simple as 1 month or as long as 6 months because they have sometimes to develop the probe.
Yes.
So once she's ready, her Lego piece is finished, we put it in ours. And we have been able to create. So there's an article from 2023 of what is the average cost of one cycle with PGTM in the United States.
Mm-hmm. What is it?
And it is around $50,000. Okay?
Wow.
Which is ridiculous. And
oh my gosh.
But this is what is worse. If, let's say, a couple that they detected in their blood that they both are carriers for Tay-Sachs or for cystic fibrosis, and they say, we have nothing, but we just detected this and we want to have a baby. How much is it going to be for us to do an IVF? No clinic can tell her. Nobody can tell them a number. It depends on the number of follicles that you develop and the medication that you use. You have to talk that to the pharmacy. Well, it depends also if your gene is one that is well known, or we have to develop a new probe. Is that de novo? And it depends if you produce one embryo or 6 embryos. Nobody can tell you. We have come up with a plan where the patients pay positive $24,500. We will take care of everything. We send them to Dr. Millie Thakur. She does her job. We agree with a pharmacy to have a fixed price with us. We agree with the laboratory, and they do the PGTA and the PGTM. We have a set fee with all the other people involved, and the patient pays one payment, and that's it. And it's half the average cost of the United States.
Wow, that's incredible.
And that's one of the big, currently 1% to 2% of all the patients that go through IVF have PGTM. And probably 10% of the cases that need to. 10% of the, it should be around 10%. But, we have 1,600 babies born every year in the United States with sickle cell disease. 100% preventable. 100% preventable. So it is only like 6,600, 400 pregnancies at risk. So it should be very easy to prevent that. And you go to cystic fibrosis and others.
So how are you able to do that when other people can't?
I don't know. I think, to be quite honest, is our industry is very benign. We are very lucky to be in this industry because it gives us a good quality of life as a physician and because you don't have calls and this and that. They pay very well. So the margins are very, very high. And people are not incentivized to go and do what we're doing. We're compromising our margins. We're getting volume, and we are basically trying to look at how we can remove pieces of the process without affecting the quality or the safety. And that requires effort. That requires a
Yes.
team that is dedicated. So actually, a lot of people will say, "But why are you doing it when you could be charging 25,000?" I mean, there's a big demand.
Yes.
We did it. We did it for many years. But at this point in my life, it doesn't feel right. It doesn't feel right. I think,
Mm,
as I mentioned,
mm,
that there is
yes.
so many advances in technology that have prompted 60% pregnancy rate. When are we thinking on giving it to everybody? When we're 100%? Now, I mean, the
Mm,
time is now that we need to
yes.
change the way we deliver care so more people can afford it.
That's wonderful, Dr. Arredondo.
And there's no incentive. I think that there is no incentive in the industry. And now, when 60, 70% of the cycles are owned by private equity, where, it's hard because a lot of times it is only focused on the money piece. There is no incentive. There is no incentive for
Yeah.
physicians or for anybody to go and try to decrease cost when the demand is so big at the high level and the supply is so low.
Well, it's incredible that you're finding ways to do this. I think it's really helpful for everyone to know that this is possible. But I guess the other side, which we just started to touch on, is that in order to do this, you need to be a specific type of patient, right? So you can't
Yeah,
be someone who needs a gestational carrier or an egg donor, let's
yeah.
say. Is that right?
We don't advertise for egg donor. We do egg donors whenever it have been our patients, and then we just feel bad to abandon them. But we don't promote it. We don't develop our own donor program, which requires a lot of resources.
Yes.
So yes, you're right. The best analogy that I could tell you is if we were in the business of doing deliveries for babies, we are a birthing center, and most of the fertility centers are level 4 NICU
Right.
and hospital. So we do very extreme cases and very easy to perform, and but make it available for them, and also in a very streamlined fashion. So we work in a team. That's what I'm telling you. There is a market for everybody, because if you want to see only one doctor all the time, we cannot offer that. We cannot offer
Hmm.
that. We're not a boutique. If you do that, you have to charge $25,000.
Hmm.
And that's what I laugh whenever other people in the market start getting panicking, and everybody has their niche, and we know what we're good at. We're good at the streamlining the process, excellent customer experience. We are not the people that want to have every personalized and this, and we personalize within our limits. Obviously, if they want to see Dr. X and Dr. X is available, obviously we do it. We're not,
Hmm.
but you have to streamline.
I think that points to my second question, which is variability in personalities and in types of patients. So if you have, let's say, someone who says, well, I want to have now I want to have my sister as my gestational carrier, and I want, a cousin to be an egg donor. And I want to, I've heard so much about endometrial biopsies. I want to try that. And I really feel like I want to not do my IVF right away. I want to do it, freeze the embryos and do it another time. And they have all of these ideas or feelings or, variable situations in their lives. How do you handle those?
We refer them. We said, there is wonderful centers here and there. They're my friends, my buddies. I will send them to them. No, absolutely. And I don't feel, the thing is that we physicians are trained to, I can solve it all. And, when fortunately in the stage that we are, as a company, as an individual's ego is not an issue. And if you want to go somewhere else because you want that, please go. We will support you, and we will facilitate for you to do it, because it's crazy how the reverse is not true. Sometimes when somebody wants to come here and they want to get their embryos, oh, they put so many. No, we help them out. I laugh at certain centers that say, "Oh, we're offering increased access and this and that," and then you try to send a patient to that center to be monitored because it's in a different city. Oh no, if it's not a patient, it's not. How are you increasing access? How are you increasing access if you don't let, but only we don't transfer embryos that is not created by us.
Oh,
How
you
are you?
don't?
No, we do,
Oh, you
but
do?
yeah, we do, but how are you increasing access if you have those policies? I mean, you have to be consistent. You have to be consistent, and that's what transparency. There are the prices. As Light says, you can record every single conversation. Every single patient has my cell phone number. Is displayed in every clinic, so you can see through the lab. It's transparency, 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 and that is we have to be consistent. That's why it's so simple to make decisions. So if you ask anybody at Positive, what do we stand for? Having a healthy baby is a universal human right. And we're accomplishing that in two ways. One, creating as many clinics as possible with the lowest cost as possible without compromising safety or quality. And two, sharing and creating new knowledge. That's what we created the IVF Academy to teach andrologists, embryologists, nurse practitioners, physician assistants, OBGYNs, everybody, and the business side. So the mission is so clear. For me and for the leadership team, is very easy to make decisions. That's the goal. If it is not aligned with the goal, somebody comes and, oh, Paco, what do you think if we do this for, and how much does it increase the pregnancy rate? Well, it may increase by 1 or 3, 5%. How much is the cost? Oh, it's, $4,000. Out. That's not going to fly. That's not going to fly. You either reduce the cost or increase the pregnancy rate with minimum amount of increasing the cost. We're already at 60%. Let's go back to this. We are at 60%. What are we going to increase it to? 65 to 70? But it's going to cost $40,000?
Right.
Makes no sense in my book.
Yes. That's so interesting. It's so interesting. It sounds wonderful. So what is this IVF Academy? Can you quickly tell us about that?
Sure. IVF Academy is an academy that has 3 branches. Laboratory, so we train andrologists and embryologists, and we have individual courses as well as long courses. And we have the business side where we have leadership, strategic, accounting. We apply the simple business model, which is a book that a friend of mine created and has been applied to Positive since day one. It's a very simple way to handle a business. And then 3, we have the clinical, which is led by Dr. Magarelli. Dr. Tony Anderson is our person in the laboratory side. Adrian Gonzalez is the business side. So Dr. Magarelli leads the nurse practitioner and physician assistants and OBGYN training, as well as the nursing, so sonographers. And so there's an ample variety of services that we provide.
That's great.
And we don't train only for ourselves. I mean, we train for anybody. Again, is sharing knowledge. Anybody can come and visit us. We are open to anybody to come and visit. We share knowledge, and just be ready whoever comes, because they're going to get a lot of questions. Sometimes we learn more from them than they learn from us.
Well, I'm sure our entire industry has a lot to learn from you, because it sounds wonderful. And I'm so glad that you decided not to retire, but instead to do this, because I think it's a wonderful example for patients out there to understand that they have choices. And there are lots of ways to do things, and it's important for them to feel empowered. It's so important. There's so much powerlessness in this experience. So I think that's great. Is there anything else you want to share with us before we start to wind down?
Just to be grateful to our team, because the team, we began 8 and we're probably at 50 by now.
Wow.
Yeah. So we're building, and the team is super, super good, and put up with a lot of our craziness and stuff. So it's the camaraderie and the culture that we have is basically the most important asset. Everybody's super cool. So I have to be grateful for the team.
It's nice. Very nice. And where can people find you?
Yeah, www.positive, and it's, as you can tell, spelled differently. Positive, POZITIVF, because we are different, so with a Z. And so that's our website. We are right now in San Antonio and in Houston, and opening Austin next year, and we're in the process already. So yeah, and Dallas will be next, most likely.
And social media?
Social media, yes. Everything that says positive, they were TikTok and everything is there. Yes, and Facebook and everybody.
Yes. And for all of you out there, you have to join Dr. Arendano on some of his TikTok lives. They're terrific and informative, but also very entertaining. So I encourage you to look him up and look up Positive Fertility. It's fantastic what you're doing. So thank you so much for coming, and thank you.
Thank you, Lisa.
And thank you to everyone out there. I really appreciate your time. It's so important to educate yourself and know your options. It's really, really essential to know that you have more control than you think. And for more information, come back next time. But for now, press subscribe because that's how we keep going. And I'll see you next week. Thank you for joining me today. I hope this was helpful to you. And if you'd like more personalized support, more information, and more education, you can find it in the show notes under the Building Your Family community. We'd love to see you inside. And if you were interested in today's topic, you will really like this video.